Welcome to Foundations of Social Work. I'm Dr. Karen Rotabi. This week we'll look at health, rehabilitation, and mental health as found in Chapter 12 of the book Social Work and Empowering Profession. We're going to consider behavioral health as a practice area, public health social work in primary care and long-term care, social work with disabilities, social work and behavioral health and mental health, and substance abuse and social work. Health is the cornerstone of human well-being, and it undergirds quality of life. A major health problem is a condition or situation that results in disease, disability, or death. Maintaining health, recovering from illness, overcoming disabilities, and dealing with behavioral health depends on people's access to resources in their physical and social environment, that is, access to care. Health is a human right and depends upon access to care and societal resources that support well-being. Health disparities result when health care resources are inaccessible, unavailable, or unaffordable to racial and ethnic minorities, people with disabilities, people with chronic illnesses, or serious mental disorders, and residents of rural communities. Social work and healthcare systems. It's a complex and comprehensive interdisciplinary network of services comprising diagnosis, treatment, rehabilitation, health maintenance, and prevention activities for all persons across the lifespan. A specific interest to social work are those people who are seeking additional social supports when confronting issues of health, illness, and disabilities. Older adults who are frail, pregnant women, people with physical or behavioral health issues and disabilities, and people who are chronically poor, ill, homeless, or medically uninsured. Social workers are employed in a variety of health settings to include hospitals, medical clinics, health maintenance organizations, home health agencies, long-term care, mental health clinics, and rehabilitation services. Virtually all areas and venues of health are included, such as emergency department, oncology, pediatrics, primary health care, public health, and hospice. These are all organizations employing social workers. Social work and public health uses an epidemiological approach to healthcare that promotes healthy lifestyles and prevents physical illness, behavioral health disorders, and other health problems on a personal level. Public health settings include maternal and child health services, health planning agencies, and the National Institutes of Health, and international settings like the World Health Organization. Public health social workers work directly with individuals, families, and small groups. They organize neighborhood and community-based efforts to address public health concerns. They assess the social context of health and disease. They strengthen the formal and informal infrastructures of social support. They plan and implement community education programs and other primary prevention strategies. This is community-based programming. Advocate for social policies that address social implications of health concerns, particularly disparities in access to health care and economic conditions that comprise health status. They also conduct epidemiological research in the area of public health, and they alleviate health disparities. Let's switch to social work and primary health care. Social workers are employed in this primary health care setting in agencies such as prepaid family health care options, community and neighborhood health centers, clinics, and medical practices and HMOs. They represent diverse characteristics of the general population, and people who access medical care in the primary health care settings are rich and poor, old and young, they may be LGBT and cisgender, and people in good health or dealing with acute or chronic illness. This is the range of people that are involved in primary health care. Their health status is often complicated by stress, poverty, food insecurity, personal and social problems like domestic violence, mental health and substance abuse disorders, family conflicts, child management issues, and other general life transitions. In these settings, social workers may carry out individual counseling, group work, counseling for health risks, depression, or substance abuse disorder, leading wellness initiatives and community education, and facilitating care coordination or medical treatment. Hospital-based social work. This is another venue. It's based on the earliest work in Massachusetts in the earliest 20th century, with main character being Ida Cannon. She was the chief of social services in the hospital where she was employed. She developed principles of medical social work that address the relationship between social and physical dimensions of illness. Today, the legacy moves on, and hospitals and other healthcare settings are important venues for social work practice today. Education is one of the expertise areas for hospital social workers. Providing support for advanced directives, living wills, and powers of attorneys is just a few examples. In large hospitals, social workers will specialize in areas like intensive care, oncology, women's health, etc. These are opportunities to very specifically specialize in the large hospital settings. So let's look at social work in emergency rooms. This is a venue for work that focuses on crisis intervention. Social workers work in interdisciplinary teams to assist people with acute illness or injuries and traumas. Also, people who have attempted suicide or have other serious mental health needs. Social workers in these settings can engage in crisis response and work directly with doctors and nurses to meet the needs of the patient in these settings. Emergency room social workers often offer concrete assistance such as helping clients obtain transportation, vouchers, food, clothing, and prescriptions. They often expedite referrals to community agencies and advocate for workable procedures and policies to keep accurate records. Okay, social work in long-term care and services and supports. Long-term care services and support offer health care, personal care, and social services over an extended period of time. Persons who utilize these services experience a combination of physical and cognitive limitations that require daily living assistance. This is daily living assistance. Many are older adults. Long-term care encompasses a continuum of services such as home health, daycare, nursing homes, and hospice programs. Employed in every aspect of long-term care, the social worker's responsibilities include direct case services, case management, as well as planning, development, evaluation, and regulation of programs. So social work in home health care. Social workers sustain people with chronic illness, social and emotional disabilities in their own homes. That is the goal. Issues like self-care, family relationships, and adjustice to illness and disability are some of the issues in this setting. Medicare has oversight in most cases and defines social workers in the setting as working to assess unmet care needs and barriers to care that impede treatment, developing plans to identify resources to sustain people in their own homes, linking clients and community-based services, coordinated referrals with the health care team. And then home health care is presented as a cost-effective solution, but such as the costs include underpaid employees like nurses and assistants. So it may be a cost-effective solution, but the burden comes on underpaid employees and nurses assistants. Social work and hospice programs. Hospice programs provide comprehensive outpatient and bereavement services for persons at end-stage terminal illness. The program is either outpatient or offered in skilled nursing facilities in most cases. Like social work, hospice promotes values of self-determination, respect, and upholding the dignity and worth of individuals as they are dying, and also helping their family members cope with these major values. Social workers are often the interface between patient and the caregivers, attending to issues like linking families to appropriate community-based services while attending to the emotional needs of a family member who has a terminal illness. Short-term case management with an emphasis on supporting both the individual and family is core to social work in hospice programs. Social work with disabilities. People with unique challenges and interruptions in accomplishing their life tasks are often those with disabilities, which occur due to a range of life experiences, accidents and illnesses, or congenital disorders. Social workers are often working as case managers for those with disabilities in a range of practice settings. Stigma is a persistent issue, and social workers recognize that social marginality of people with disabilities often feel. These are critical in helping people cope with disability is recognizing stigma, shame and stigma. Helping people adapt and cope with their challenges are important elements to working with those living with disability. Also working with their families and their own stress and coping, which is also challenging. Promoting consumer voice and choice for people with disabilities is an important element in recognizing that people with disabilities are consumers of services and experts in their own life experiences and identifying their own needs. Social workers are committed to directly involving persons with disabilities and developing comprehensive service plans, and selecting service providers is a core theme of disability rights. Gives people with disability power and control over their own decision making. However, there are challenges for social workers, which include the question, who are the clients, persons with disabilities or their families? How does one balance self-determination and concern for individual safety? How do professionals ensure personal choice in the face of shortages of services and funding and the press for cost containment? Behavioral health is an area important area for social work and refers to personal dimensions of adjustment and on macro level an integrative system of services. Behavioral health problems such as emotional distress, suicidal ideation, and substance abuse, along with other mental health disorders, can range from transient to more persistent and chronic problems. Prevalence of behavioral health issues. In 2015, a study indicated that about 18% of the population in the U.S. aged 18 or older, 43.4 million people, were affected by mental disorders, excluding substance abuse disorders. 4% had serious and persistent mental illness such as schizophrenia and bipolar disorder, as well as severe forms of depression. Depression is the leading cause of disability in the United States globally. Social work and mental health services. Social workers are among the main service providers of mental health inpatient and outpatient services for individuals with acute or chronic mental disorders. There are specialized areas of knowledge, including the diagnostic assessment using the DSM-5, evidence-based behavioral health programs and services, trauma-informed care, the law, due process, the client's rights regarding involuntary and voluntary commitment, ethical and legal issues such as confidentiality and duty to warn, procedures for dealing with crisis such as suicide, psychotic episodes, and violent aggression. Substance abuse. Drug and alcohol abuse is not in and of itself a disorder. However, its use can lead to behavioral health issues that are problematic. Substance misuse can interfere with judgment and the ability to carry out social roles and obligations. Prevalence. The illicit drug use and alcohol use amongst the U.S. populations aged 12 and older is about 10% of the populations. Substance abuse and social work. Social workers, if employed in a specialized addiction treatment program or parallel first field, have the base of knowledge and practice and knowledge, including the nature and dynamics of substance abuse disorders, up-to-date diagnostic criteria for substance use disorders and co-occurring conditions, systematic effects of substance use disorders, particularly in relation to families and children, cyclical characteristics of recovery and relapse, community resources available for supporting ongoing recovery and abstinence, culturally appropriate evidence-based practices, legal regulations, and ethical considerations such as informed consent, privacy, confidentiality, and access to records. Thank you.